Welcome to the COVID Diaries project being run by the Community College Systems in New Hampshire. I'm Rosie Johnson from River Valley Community College. Would you introduce yourself, please?
I'm Cally Lavigne, and I'm a resident of West Lebanon.
All right, so do you have a story of how COVID has affected your life?
COVID has affected my life in a number of ways. I'm particularly fortunate in that it didn't make a major impact, in that I didn't lose my job because I'm retired. And my life pretty much goes on the way it always did since retirement, with one really important exception, and that is that I feel very much isolated from human contact. Since I'm in what a friend of mine calls the dead pool, that is, people who are over 65 and have underlying conditions, medical conditions, I'm trying very hard not to get the virus, which means that I don't go out very often. When I go shopping, I go early in the morning. I pick stores that are not likely to be crowded. I do what I need to do, and then I come home. A lot of my social interactions have either ceased or are conducted on Zoom, which is much better than nothing, but it leaves a lot to be desired. For example, my church, very important part of my life, and the services go on Zoom, and that provides the spiritual aspect I need. But the coffee hour afterwards was just as much a part of the worship service, in my mind, as the sermon and the hymns and the whole business.
Absolutely.
And it just doesn't happen.
I miss the coffee hour too. In fact, one of my favorite things to do in the morning would be to volunteer and go get the Panera donations.
And that is so appreciated. And that's one of the nice things, is it's a place where everybody can contribute. So often growing up in the church, if you were the young person, you sat there and did nothing, and the adults did everything. It's let me do something, and that's a place where everybody can assist. Involving young people, the really young people, was wonderful. I just miss that.
Well, my personnel volunteer contribution required having a driver's license and access to a car.
Yeah. And that is a definite asset. You're clearly better off than I was. When I got my car, I thought got a driver's license, rather. I didn't get a car. I thought I was going to be able to go all kinds of interesting places. Didn't work out that way. My parents' view of this, and they controlled the car, was I'd take my brother and myself to choir practice, to Sunday night youth group, and similar exciting things. Driving all over, Virginia was not on the list of things to do. So, but that was then.
And now it's kind of back in the same sort of structure, only essential trips.
Only essential trips, and even the essential trips get cut to the absolute minimum.
Exactly.
I used to go to I'd go to the co-op, and yes, I got my groceries, but there was a lot of chit-chatting with people I met in the aisles, the staff, and now, hello, how are you? Doing well? Goodbye. I don't do that anymore. I work at a yarn shop one day a week for about 4 hours. And it used to be, back in the good old days, people would come in with their knitting problems and they'd sit down and we'd talk and we'd fix their knitting and I'd watch what they did. And it was a wonderful social action. Now, because of the virus, we want people to come in and get their yarn and go away.
Yep.
And so I spend a lot of time when I'm there by myself. Guess what? That's even worse than being at home, because at home I have a golden retriever.
A very sweet one.
Yes, she's a love. And she doesn't like the virus. She doesn't understand. But nobody comes to the house anymore.
Aww.
And she doesn't get her ear scratches and so on. And she's feeling very abused. Now, she's not an abused dog, you must understand, but she thinks she is.
She's not used to not seeing as many people.
Mm-hmm. And the other thing I used to do was to go out to lunch with people, either at their place, at my place, or at a restaurant, just because we have the time to do it. No, I can't do that anymore. Another activity that I can't participate in exactly was Girl Scouts. I am, believe it or not, a leader of a Girl Scout troop of the very youngest, the Daisies up through Brownies. And we're doing it with Zoom, and that's good. It's better than nothing. But again, trying to teach someone to knit when you can't sit beside them, you have to, it's a face-to-face, and
showing them the needles in the camera. Okay, do this, but do it facing you.
Yes, do it backwards. And
that's it. You teach them how to purl while you knit, and you teach them how to knit while you purl.
I hadn't thought of that. Now you've done it, Rosie. Now I've got to go off and think about that one.
Well, you taught me how to knit.
I did, and I sat beside you. And your mother and I were laughing. Well, I shouldn't say laughing stock. Everybody giggled at us at church. You all would come in and your mother would hand me her knitting. And then about the first hymn, I'd give it back to her with the stitches picked up or whatever. And she's got beyond that.
She's got another mistake that needs fixing, and I don't know how to fix it. And she hasn't been able to bring it to you because of the virus.
Well, we ought to do something like she can drop it off at my house, drop it off under the mailbox, and I'll fix it. But it's the isolation.
Absolutely.
Another aspect, and this is again being mature, is dealing with death. I last week lost a cousin very close to me when I was growing up, and he lived in North Carolina, and I knew he was ill. I knew he was dying, and I couldn't justify going down there. Partly because if he was hospitalized, and here I'm coming from New Hampshire, bringing all my New Hampshire viruses, and the other one was they're in North Carolina and they have their viruses. It just seemed a bad solution all the way around. And yet I miss being able to say goodbye.
A lot of hospitals, the one here, DHMC, they're not accepting visitors, last I heard. Anyway.
Yeah. And I couldn't even if I couldn't visit Tom, I could have at least hugged his wife. Well, no, I couldn't, because she's a nurse and is being very careful about the virus. So again, it changes those relationships. We'll get together and do a memorial service of some sort for Tom if and when this virus ever goes away, so that we can be safe. Oh, I know one new thing. I have never, ever in my life done a happy dance because I was scheduled to get a shot.
Oh.
But I am scheduled for my first COVID vaccine into February, but still on schedule. And I'm just so thrilled I can hardly stand it. I'm doing a happy dance because I'm going to go get a shot.
Well, it's almost February.
Yeah, that's weird. I mean, it prompts people to do, prompts me, I don't know about other people, prompts me to do things like sorting.
Sorting what?
Yeah, of course, yarn.
Oh, okay.
Needles. I have a collection, and they've just sort of been accumulating over the years. And I've gone back and pulled out unfinished projects, which we knitters call UFOs, unfinished objects. And some of them are very discouraging because the young man that I started this sweater for finished graduate school 2 years ago and has his PhD. So it's been a while. And I have some things that I cannot believe I bought. Surely someone gave them to me. I can't remember where or when, and I have no idea what I'm going to do with them. But that's the good news. The bad news is that poor Katie can't get on the sofa in the living room because I have all these boxes of unsorted stuff. And she regards this as just another instance of puppy abuse. And it does make it, I want to sit down and watch a TV program. Well, the living room is full of stuff, and it's not too conducive.
Reminds me of how I can't watch my favorite TV program because everyone else is home and they don't like listening to it.
Yeah. There are some advantages to being by yourself.
I can tell. Not being by myself, I can imagine.
Well, it's like everything else. It's a mixed bag.
Absolutely.
But if I want to have oatmeal for supper 8 days in a row,
no one's judging you.
No one is judging. No one even knows.
Well, Katie knows. She might want some.
Of course, Katie knows, and Katie wants some. On the other hand, when you get down in the dumps, at 2:00 in the morning, there's nobody that you can wake up and they have to listen to you. I have some friends that I probably could call at 2:00 in the morning and they might be up, but it's not like somebody that you can face-to-face talk with.
Well, I don't personally have anyone I can face-to-face talk with it too. They're all grumpy then, but
yeah,
I know what you mean.
That's the problem. I'm up. Why aren't you? Sort of attitude.
Well, insomnia is a whole nother story for me.
Yes. What else can I tell you about COVID? Other than the fact that I don't like it, I don't approve of it, and I'm sick unto death of it. There.
That pretty much sums up the general attitude I've heard about, actually.
Yeah. Phone communication is really important.
Mm-hmm.
I have a number of people that I check in with every day, some in the morning, some in the afternoon. And, we don't have deep, meaningful conversations. It's just, hello, how are you? What exciting is happening today? And the answer is usually nothing. Well, I'm going to CVS this morning. Ooh, that's really
a voyage.
Yes. Oh, an adventure even. It's more to hear another person's voice.
Yeah.
There's some safety issues of, okay, I'm pretty sure that if something happens to me in the night, somebody will say, hey, I haven't heard from her, and start calling and then start poking around to see what has she done this time. And, sometimes it's just, well, I was up until 4 a.m. dealing with a knitting problem, and I just slept through when I was supposed to call you. But that's the good kind of stuff. I just don't want it to, there's nowhere I'm supposed to be, so no one would notice if I didn't show up.
Yeah.
And that's important. It's also important for just to hear the sound of a human voice.
Oh, yeah.
I remember when our church first went on Zoom, how wonderful it was to see faces. I mean, I know what you folks look like. I've known what you look like for years. But I just to see a face, okay? Yeah, there's Rosie. And she looks just like she always did. I mean, you know, this is clearly Rosie. Nothing dramatic has happened, but I'm seeing a face, and that's nice, as opposed to sort of wondering, now, is that really Rosie, or has my brain done that image with somebody else's face, or as I did the other night, call you by your mother's name, and you know all the things that old ladies do.
Well, over the phone, I sometimes sound like Mom.